Hello and welcome once again to Moorgate Andrology. Now in today's video we're going to talk about penis enlargement surgery and preoperatively how to prepare for penis enlargement surgery. So imagine you booked your operation, got your date for the surgery, all the plans are in place. So it's worth just taking a look, a bit of a heads up at the things that you must do and things that are a good idea to do before the surgery. Now, the first thing is when you've booked an operation is you're going to need to think about some time off work. So what kind of work do you do? Do you have a sedentary job where, you're sat at the desk all day or perhaps working from home? In this case, we advise that really 2 to 3 days off work should be enough. And most patients are back at work after 2 or 3 days. You may feel a little bit sore, you may have some bruising on belly or the inner thighs where we took the fat from for fat transfer, but this really doesn't slow you down too much if you have a sedentary job. On the other hand, if your job is more physical, then you may need to think about taking up to a week off work. So time off work is important, and obviously if you've already scheduled a date, then I'm sure this is something you've already thought about. But if you haven't booked the date yet, then maybe that's one of the first things to look at is when is it convenient for you to do the surgery. So time off work. The second thing is it's really helpful if you are a smoker that you stop smoking 6 weeks before the surgery, and after the surgery continue to refrain from smoking for a further 6 weeks. This is because smoking increases risk of infection and also can delay wound healing and lead to wound complications. So if you can quit smoking 6 weeks before and 6 weeks after, this is going to really help. The next thing to think about is, something pretty basic but nonetheless important is your shopping. So if you feel a little bit tired the first day or two after the anesthetic, you may not feel like going to the shops. So go to the shops, stock up on some groceries and so on, so you have everything you need to see you through maybe the first week. And the other good tip is when you're out there shopping, pick up some extra pain relief medications such as paracetamol and maybe a pack or two of dressings, just so that you've got this extra kit if you should need it. When you discharge from the hospital, you will have antibiotics and pain relief medication. It's a good idea to top up on these things just in case. Also, it's best to avoid alcohol for 48 hours before the surgery. And after the surgery, it's a good idea not to take any alcohol whilst you're on the antibiotics. But before the surgery, try and avoid alcohol 48 hours at least before the operation. Now, you need to think about traveling to the hospital and back, because after a general anesthetic, you can't drive home or go home alone on public transport. So you need to plan to have somebody with you to meet you at the hospital and take you home. If you have an overnight stay booked at the hospital, then that might be different. The next day, when you're recovered, you may be able to go home unaccompanied. But most of the procedures that we perform are day cases, and you do need someone to take you home. You should have someone with you for the first 24 hours after the surgery. If that's possible, it's a good idea to have somebody with you the first night after the surgery. Now, there are some practical steps that you'll need to do for our patient care team when you book the surgery. And these are really important, and it's really vital that you don't delay in any of these actions. Because if you do, it could be that your operation needs to be postponed to a later date. and we don't want that. The first thing to do is to remember to sign all the documentation. You will have some preoperative instructions coming across, usually by email. This contains a lot of information about the surgery, some documents that you sign digitally. So it's really important to get those back to our patient care team on time and as soon as possible. You will be asked to get something called a GP summary. This is a document from your doctor to confirm your medical history, details of medication you're taking, etc., that you would have told us as part of your screening earlier in the process. This GP summary is really important, and our advice is that as soon as you book the surgery, contact your GP to arrange for this GP summary to come. Now, sometimes it can take GPs a little time to get this to you. They may supply it you by email, or they may ask you to go to the practice and collect it. But either way, we need a copy. So don't waste any time contacting your GP and asking for this when you do the surgery. Another thing is preoperative tests. Depending on the procedure you're having and your medical history, you will have some preoperative tests to do. For most patients, this is simply an MRSA swab test and a COVID test, which will come in the post. But do them only on the day that you're asked to do by our patient care team. Don't do them too early. Don't do them too late. Do them on the day you're asked to do and put them back in the post. If you're asked to attend our laboratory for any other tests, such as blood tests, maybe ECG or chest x-ray, then it's really important, obviously, that you attend for those surgery. And yeah, if you fail to follow any of the preoperative advice, then or don't do things in a timely manner, then the operation will have to be postponed. These are really important checks that our medical team have to do to make sure that you're fit and well for surgery and properly prepared. Our patient care team are on hand to guide you and to answer any questions if there's anything that you don't understand. So that's all from me for now. I hope that's given you some insight into the preparation for penis enlargement surgery and the steps that you need to take. As we said, we're here, and any time you need to ask any questions or you need any further advice. Well, that's all from me today. I hope that's given you some insight into the preparation for penis enlargement surgery. But until next time, that's all from me today. I look forward to seeing you back here at Moorgate Andrology very soon. But until then, bye for now.